Let's get the latest. We cross now to SABC News reporter Simphiwe Makhanya in Pietermaritzburg. Simphiwe, I guess the main message coming through is stay calm. This is under control right now.
Certainly, Francis, the Minister of Health, Dr. Zweli Mkhize, has been holding various meetings with different stakeholders in the province, trying to assure them that the National Department of Health will be in a position to act decisively to deal with the issue of the coronavirus outbreak, since, of course, the news of that confirmation of one patient was reported yesterday. Francis, I'm not going to waste time because I'm now joined by the Minister himself, who has been holding various meetings since early this morning. Minister, thank you very much for your time. Just for clarity, Minister, as it stands now, how many people in South Africa have this virus?
Well, we have only confirmed one person, and that person is located in KwaZulu-Natal, outside the city of Pietermaritzburg, and there's only one person. I think the media need to be aware that there are lots of people who are sending fake news, wrong information, disinformation. Some people are just pulling pranks on us. As long as it has not been announced by the Department of Health, it is fake. It is not possible for any numbers of people to be found to be positive without the minister knowing, without the department knowing, and therefore some of the stories we must just disregard. What is important for now is that we have only got one, and over the past 2 months we have not had any other case.
What is the condition of the patient in question?
The patient's condition is very stable. He's actually reported in the media that he's actually feeling better. Already there was a debate whether a person with that kind of level of symptoms should have been admitted. We agreed that no, the patient has to be admitted really to follow the protocols, but he is actually much improved, and I think what's important for us is that he must stay in treatment, and then once he's been treated, and we will therefore test him as soon as his symptoms disappear, and then when he is found to be negative for COVID-19, we'll allow him to go home. That means it can be any time, and there's no specific time left specified for how long the person needs to stay in the hospital. It really depends on the condition, the severity of the infection, and the existence of other concomitant diseases, and what other supportive treatment the person needs. In some instances, I spoke to some professor in Hong Kong who told me that 10% of the patients ended up needing ventilation. We're not there yet. Our numbers are right now we've only got one. So when they've got large numbers, you have to start thinking about those issues. Right now we have no challenge whatsoever. We believe that everything is stable and is going well.
Right. Minister, I'm sure you'd understand though the concerns that have been raised by a number of South Africans, saying that our healthcare in the country is not in a state to be able to deal with such a virus. How sure are you that as a country we are well prepared and we will be able to deal with the virus?
Well, let me say this, that there is no country that can say that there is nothing to fault on their system about dealing with the disease. Now we're getting criticized even before we got the first patient who's coronavirus positive. We just think that people are conflating two issues. The challenges that are besetting the health system are actually acknowledged. We have had challenges of overcrowding, staff shortages, a shortage of medicines here and there, and so on. That's very different. It's a problem that we have to deal with, increase the funding, retrain people, and reorganize the system. All of that is something that we're going to take a long time to as we deal with it. On the other hand, we've got an emergency, and coronavirus is one of those types of emergencies. And to deal with it, we've got specific interventions, because it's not just an emergency, it's an emergency wherein we have to cut the cycle of infection very quickly. And therefore, we believe that we are capable of dealing with that. We've dealt with a lot of other difficult situations before. We've dealt with hemorrhagic fevers, we've dealt with the cases of SARS in those days. We were able to deal with them. In this case, we're just saying to our community that we will be able to deal with this one. If we look at what happened in the other countries, there are lots of challenges that they're also facing. If you look at in China, they've got 80,000 people. If you look at the whole world, we've now got close to 20,000 people who are actually infected. And all of those systems, some of them have been doing well before, but this is not a one-way stream where you just look at whether you've got shortages of nurses and so on. You look at also on the messaging that goes to the community. You look at the response of the community. You look at the cooperation and how united people are in fighting the infection. It requires us to work together, because this disease will actually be defeated more by the community than by the health services. In the health services, it's only those who are infected. In the community, it's actually making sure that we limit the numbers that will be exposed to the virus, and therefore reduce the numbers that could be infected. What would be good for us is that the one that we have already identified, will get him in, treat him, and make sure that when he leaves he's well, and also that no health worker has been infected in the process. And then with those contacts, those who are in immediate contact with him, will be tested. Those who are positive must be treated. Those who are negative will also be given a space to make sure that we keep them under observation. At the right time, we also just make sure that they go. So there is a systematic way of dealing with this thing, and we can deal with it even though we still have all these other challenges in the health sector. So we just want our people to understand that dealing with this issue as an emergency is actually, we have all geared up for it. We'll be able to deal with it. But we need the support to reduce the rate of spread and the numbers of people who are going to be exposed. We need everyone to cooperate.
Minister, you've just come out of a meeting with health practitioners. What are they telling you?
Well, the nurses and the doctors, they are ready. They don't have any problem. They understand exactly what they need to do. They are actually very competent professionals, so they don't have any problem whatsoever. They've just been asking specific questions about how we go about some of the issues. So we've demonstrated that we've got the kits, what we call PPEs. We've also demonstrated to them that we've actually increased the stocks. So for one patient, whatever we have is sufficient. We've also indicated to them that we are continuing to talk to the community so that we can reduce the problem. In between, they raise other issues: how do we handle the corpses, if there's any such event, the eventuality, how to deal with the billing of such situations, how do you make sure that anyone else around there is properly informed. If you have been treating a patient, can you go home? And the answer is simply yes. What we need to make sure is that they don't break the barrier nursing code, which means there must be no part of the body that's exposed, whether it's broken gloves or torn covering clothes and so on. If that happens, they must report that. So they are actually generally ready. If you came in earlier, I would have been seeing everybody was singing there and so on. They're not afraid of this virus. Of course, if you go around the hospital and so on where there's less information, you might find people saying various things. But as we speak, we fight.
Minister, just one more minute before we let you go. The issue of repatriating South Africans in China, how far is the process?
That process is ongoing. We did say on Sunday, we said we wait for 7 to 10 days. We're still within that time. We are quite happy that the processes are advanced, and that because we have to deal with emergency procurement mechanism, we have to get into negotiations at short notice and get to sign what you call agreements within a short space of time. All of those things are causing the delay. That's why we said 7 to 10 days. But everything is on course as far as we're concerned. With those members will be coming back. It's important to say to South Africans that those people are not infected. We just want to take a precaution that because they have to come back, that when they do come back, they do not infect anyone. So we'll keep them in a quarantine for 14 days, and after they've left Wuhan, thereafter we'll test them and make sure that they go out into the community, they are fine. There are those who are in the Diamond Princess ship. The two that were found to be positive, they went for treatment, and we have been assured that they are now well. And when they are well, we actually don't even bother about them. They must get onto commercial flights and come back. They are no longer posing any danger to anybody. And then those that are negative, we want to count 14 days since the last time they were exposed to the infected ship, and thereafter we will then release them if they test negative. If they are positive, they continue for treatment. If they are negative, they will come back. We also will not even bother where they are. But we continue to be vigilant, and we are testing everyone when they come into the airport. We look at their conditions, we'll test them further. All of this is to make sure that the safety of South Africans is not compromised. But we are not calling for travel bans or grounding aircrafts or stopping flying to various countries. We think that the disease, the infection, doesn't look at passport, doesn't look at nationality. It just looks at whether you are observing the simple basic rules of hygiene, and therefore that's what we're going to keep up to.
Minister, thank you very much for your time.
Thank you very much.
That was the Minister of Health in the country, Dr. Zweli Mkhize, saying that South Africans must remain calm. They are confident that they have put all the necessary measures to ensure that this virus does not spread any further. It's back to you in Johannesburg for now, Griselda and Francis.
Simphiwe, very quickly before you go, there's this building behind you. We see nurses in the background. Just tell us exactly where the patient is being held and how the 18 that he came into contact with are being dealt with. Just confirm those details again for us.
The issue of the patient in question, Francis, what we can tell you is that he's currently receiving treatment here at this hospital, Grace Hospital. He's in an isolation ward. What we are seeing behind me is the actually the room where the minister has just finished having a meeting with the health practitioners who were raising a number of issues with him. In terms of the 18 others, Francis, what I can tell you is that they were tested. Some of the results have not yet come out, but they remain obviously a question. There remain questions around them as to whether they have this virus or not.
Thank you very much. The SABC's Simphiwe Makhanya in Pietermaritzburg, and we understand there will be further information released from the health department at around 7 o'clock, and we'll keep you updated throughout the evening.